Hi everyone, Dr. Michelle Atchison. I'm the chair of the section for private practice psychiatry for our college, and I'm a private psychiatrist in Adelaide. I want to talk today about some practical tips for managing the COVID environment in private practice, particularly some practical tips on how to return to seeing patients face to face. We'd all know that COVID has had a major impact upon the way that we practice psychiatry and how we manage seeing patients in private practice. With COVID, there was the very rapid introduction in Australia, as you would know, for Medicare subsidies for telehealth item numbers. This meant that for many private psychiatrists, we could move quite quickly to seeing patients through telehealth, although it's interesting to note that the information from Department of Health in May shows that probably about half the consultations private psychiatrists were doing in Australia were through telehealth, but the other half were still through face-to-face. We're now in the position in many states and areas of trying to decide whether to see patients again face-to-face. Many of us have moved to doing that, and there are still areas that are unsafe and that telehealth needs to be the major form of seeing patients. If we're thinking about returning to practicing and seeing people face-to-face, there are several areas that you need to think about to minimise the risk of COVID infection for yourself, for your staff, and for patients that you're seeing. There are three broad areas I think that we need to look at for minimising risk. Firstly, about screening patients who may be unwell so that they don't come into our practice. Secondly, about reducing the number of people that you and your staff come in contact with. And thirdly, about reducing touch points and cleaning regularly in your practice. I've got some accompanying video that shows what we've done practically in our rooms, and that might be helpful just to give you some guidance. Firstly, about screening patients who may be unwell. We send out a text message for all our patients for appointments, so we've added on some information there saying that if you're unwell, don't come to the consultation. Now, we all know that some patients take notice of that, some people don't. So what we want to do then is to screen and try to minimise the risk of an unwell patient coming into the practice. What we do in our practice, we've got a very large banner on our front door that clearly says, if you are unwell, don't come in. What we've also done is we've decided to lock our front door. That way, when patients come to the rooms, they can't just walk straight in. So they have to stand at the front door. Hopefully they will look at the banner that's on the front door, and our staff can come and greet them. When our staff come and greet them, we let people in ourselves. We take their temperature. If they're over 38 degrees, we would send them home. Having said that, we haven't had anyone in that position as yet. And we ask them to use some hand sanitizer. If you believe that the patient is unwell when they're coming into your rooms, it's best to turn them around, either do the consultation by telehealth while they're sitting in their car, or ask them to rebook the consultation. The second area is probably about reducing the actual number of people who are in your rooms and who you come into contact with. That just minimises risk. What we've done in our rooms is we've taken out half the chairs in the waiting room just so that we can't have the same number of people sitting in the waiting room, and we can socially distance people who are there. We ask patients not to bring any family or carers with them unless that person is going to come into the consultation with the psychiatrist. We specifically ask that people aren't sitting in the waiting room as family and carers whilst the patient's having their consultation. In that case, we would ask them to either go back to the car and sit in the car, or we put a chair outside and they can sit outside. In determining how many people you should have in your waiting room or even in your consultation room, you need to think about social distancing, and you need to think about the 1.5 or 2 square metre rule so that you can have the appropriate number of people in your waiting room. The third area is about reducing touch points and cleaning the rooms regularly. So what we do is we bring people into the rooms. So we open the front door for them. When they leave the consultation, after they've paid their account, we let them out as well. This just minimises other people touching the front door. I do the same in my consultation room so that I let the patients in, I close the door, and at the end of the consultation, I get up and I open the door and I let the patients out. You've got to be aware about touch points, I suppose, within the consultation room. So we've cleared out any magazines. We don't want things that people can pick up and touch and then have someone else touch. We've put up sneeze screen guards for our receptionists so that they minimise the risk of someone sneezing or coughing on them while they're doing their accounts. It's also just a bit of a visual reminder, I think, that we're taking COVID seriously, and that leaning over and talking closely with people is just not the right thing to do anymore. Those sneeze screens are readily available in a variety of plastics manufacturers online. You just have to Google that. The same with the poster that we put on our front door. That was through a company that I just Googled, and we were able to make up one specifically for our room. The other area that you might want to think about is your toilets. Not something that we would usually have to put much thought into, but really in a time of COVID, you need to be thinking carefully about that. We used to use hand towels for people, and now we've moved to paper towels. We've bought some containers that I've got photos of in accompanying that show the sort of hand towels that we use. We've also got a notice there that says to the patients to use the hand towels to wipe their hands, but then to use that same hand towel to open the toilet door and put the hand towel outside in a bin. That just minimises any risk of, again, people touching and other people, yourself or other people going and touching those touch points again. Cleaning regularly, need to clean with Glen 20 or something, all the soft furnishings. You need to wipe over with disinfectant wipes or any touch points that people might be using during the day. We've gone to having our cleaners come weekly rather than fortnightly, just so that we can feel that the place is thoroughly cleaned. I suppose the last area is around PPE and whether you should be wearing a mask while you're seeing patients. Clearly a hot topic, and people have different views about this. My view is that masks help me to not pass on an infection to other people. But if I was in the position where I felt that patients needed to be wearing masks, I wouldn't be seeing people face to face. I would be using telehealth. There's an accompanying website link here. So if you are exploring the use of PPE, the college has some areas that you might like to look to purchase that. Just to finish, the COVID environment has changed how we practice. It's changed the level of anxiety about seeing patients face to face and whether we might infect people or whether people might infect us. In the end, we all have to make a kind of balanced judgment about whether we're safe seeing our patients face to face, both for ourselves, for our staff and for the patients. And that will depend on what area you're working in, your own health, and the sort of patient mix that you're seeing. If you have any questions about how to manage the practicalities of face-to-face consultations and keeping COVID safe, please feel free to contact the section for private practice psychiatry through the college, and we would be very happy to give you some help and advice.